Hello, my name is Ralph Hills. I'm in the United States near New York City. I've been in AML treatments for 12 years. Very fortunate to be here. And I'm also the patient chair of Know AML in London. For the first 2 years, I was completely at the mercy of AML and my clinical trial treatments. I was in bed 24 hours a day for 7 months, then slowly recovering 42 pounds, overcoming so many lasting treatments. This may not happen to other people, of course. My wife gave up her entire life, taking care of me, taking me on day-long trips to New York City for tests and treatments, keeping people away to avoid infections, managing prescriptions, and keeping our small business going. Yes, we did try to manage these long days, but mostly we had to decide to endure them and persevere. Sometimes several days I remember being surprised to actually wake up during those first 4 months. Since my first day knowing I had AML, there's been tremendous progress in diagnosis and treatment. So every day there's more reason for hope.
I'm Anna Mamwell. I'm a Know AML Ambassador in the UK. I was diagnosed with AML in 2015 and I've been in remission ever since. So side effects can be really grueling, and I was very much the same as Ralph. I was in hospital for months, bedridden. There's a lot of potential side effects and we're all different, so we don't always all get the same side effects. So something that affected me might not affect the next person, but there are obviously ones that are pretty much something that everyone would have. My experience during treatment was extremely tough. It's hard to find words, but with the support and the really great medical team I had around me, obviously I got through that. And there's as much for me on the emotional side as there was on the physical side. There's lots of physical symptoms, obviously, that then bleeds into the sort of mental side of things. So you need to try and look after your mental health. It's not easy because there's so much going on all the time, and you never know what the next day is going to be like. But how I started to come to terms with it after my initial sort of first round of chemo, I started to realise that I needed to take one day at a time. And I know we say that a lot in our daily lives, but I didn't really realise how much that meant or what that meant until I was in that hospital bed, sort of in four walls with this really, really awful illness. So I started to break my days down even to, I'm not going to think about this afternoon, I'm just going to think about this morning. What have I this morning? What bloods have I got to have? And then, there would be certain routines in hospital that happen every day, and they become something that break up your day. So when the lovely cleaning lady would come round, it would break up my day a bit, because we'd have a bit of a conversation. So I really found what helped me was not thinking about being in hospital for weeks and thinking the really long, big picture, and that would be too much. I would break it back down to the day, and that really, really helped, because before that, it's quite tough to have that thought that you're going to be, in bed or in hospital for such a long time. So back to sort of side effects, I did tend to have the same ones each cycle. So you do sort of start to learn, right, this is going to happen to me every time. I had colitis, which was extremely painful and not nice at all. And on all the other things that you get, such as hair loss and nausea and sickness. But what I would say to people is don't suffer in silence. Make sure that everything you're feeling, every side effect, or if there's anything you don't feel quite right about, question that and ask. Because there are lots of times there are medications that can help with side effects. And on that, sometimes you have to try several different ones until you find the one that works for you. So for my anti-sickness, I had to try about 4 different types before anything worked. So don't sort of feel like if you've started something and it's not working, that's it and you have to suffer. There are lots and lots of things they can do to support you and to support your health going through it. So that's one thing that I would kind of say from my experience. And it is a lot. There is a lot. But I started to sort of ask questions. I had like a pain in my elbow, and I asked them to check that, and that reassured me, because you do end up feeling sort of that you don't trust your body anymore, and you don't know what's a normal thing that's happening to you or what's something that might be a problem. So that was sort of something that I would take away from it as well. The impact on daily life obviously was massive for me. Being in hospital for months, I didn't work, and I couldn't be a parent to my daughter. But as Ralph says, there's so much more new treatments and new knowledge out now from when I was going through it. So treatments are getting better and better all the time, and not everyone has to have really intense treatment like I did. But, you know, the impacts of what I went through 10 years on is still affecting me. Physically and mentally. It does, obviously, with everything, get better in time, and I've learned to try and eat healthy things and that kind of thing to give my body as much help as I can, but it does change that. And I think when I first finished treatment, all I kept thinking to myself was, I can't wait to get back to normal. I've never gone back to normal, and that's when I know people talk about the new normal. And once I started to accept that, I was more at peace with it. But at first, I spent the first, I don't know, maybe even the first year fighting to get back to where I was, and that was never going to happen. Once I realised that and I accepted, right, that's fine, let's build on what I've got, I really did cope with it a lot better. But, you know, it is life-changing, and that's okay. You know, so it's okay that that's the case, and it's okay not to be okay. It's okay to have sad times, because I know I do sometimes feel like I haven't got a right to be sad because I've survived this terrible thing. But equally, you know, I feel now, from what I've learned, that it's okay to sit in that moment, let it pass, because it will, and you do then feel better.